This is the story of Little Red, a young adult with type 1 diabetes. Several years ago, Little Red's immune system accidentally killed off the part of her pancreas that allowed her to produce her own insulin. Now, she takes multiple daily injections of synthetic insulin, balances her carbohydrate intake, and monitors her own blood glucose levels with a prick of the finger 10 times a day. Also, every 3 months, Little Red must trek through the forest, over the mountains, and around the valleys to visit her diabetes specialist at the nearby hospital. Lately, though, Little Red has run into some trouble. Often, she meets a big, bad wolf named Doubt in the forest. He likes to tell her that she's managing her diabetes all wrong, not testing her blood glucose levels enough, not counting her carbohydrates in the right way. He even brings up the time she forgot to take her insulin. This meeting makes Little Red sad and anxious, and this anxiety causes her blood glucose levels to go higher and higher as she begins her climb through the mountains. When it's time to check her blood glucose next, her levels are uncomfortably high. She feels thirsty and tired. Then she meets another big, bad wolf named Diabetes Complications. This big, bad wolf reminds her of all of the horrible things that could happen in the future because of prolonged high blood glucose readings. Neuropathy, vision problems, blindness, kidney failure, heart disease, amputations. Little Red drinks some water for the thirst and takes a shot of insulin to correct the high blood glucose reading to get away from the diabetes complications as quickly as possible. Unfortunately, the exercise of climbing the mountain makes her more sensitive to the insulin. So, as she races down the mountain, Little Red's blood glucose comes crashing down to dangerously low levels. Sweaty and confused, Little Red now meets the third big, bad wolf of her trek, hypoglycemia. This big, bad wolf reminds her of all the horrible things that can happen because of low blood glucose levels: fainting, seizures, coma, death. Fortunately, Little Red is prepared for such emergencies and has a snack packed in her basket. By the time she nears the hospital for her appointment, her levels are back to normal. Exhausted from the journey, this is where Little Red meets the fourth and final big, bad wolf, guilt. He says she should have caught her high blood glucose levels before they got so high and felt her low blood glucose levels before they got so low. He says she can't do anything right because she is a bad diabetic. This scenario plays out over and over in different variations throughout Little Red's journey in life with type 1 diabetes. Eventually, she begins to feel less inclined to test her blood and count her carbohydrates and go to the doctor. Isolated and weighed down, Little Red feels sad and depressed. Now, she stops venturing out altogether. So, what do we do about this? Well, we could say that Little Red is not trying hard enough and needs to learn to ignore the big bad wolves in her life. Or could we rewrite this story? Instead of making Little Red take these journeys alone, let's introduce her to other adults with type 1 diabetes. Now she sees that her struggle to keep up with her diabetes management all day, every day, is actually quite normal. She stops feeling like she's doing everything wrong and starts feeling like she is doing the best she can. She sees other people testing their blood glucose levels and decides to test hers more often too. She catches her blood glucose levels before they go dangerously high or low. She feels better, gets more active, starts to venture out more, and begins to visit her healthcare team more regularly. Sadly, Little Red's story of isolation is a reality for too many adults living with type 1 diabetes. Luckily, the rewritten story is also becoming a reality.